Hey, good afternoon again. It's Miss Gail. Listen, I'm trying to get these last two chapters taught to y'all. They will be up online. Hopefully, we will be back, but just in case we're not, then y'all will at least have me talking through these chapters with y'all. And then you know that I'm always available. Okay, so chapter 17, critical care dosage calculations. It's a little bit tricky in this chapter, but follow me and we will get through this. Critical care is a nursing specialty that focuses on the care of patients who require close monitoring. Been a lot of talk in our nation about critical care units. So I'm sure y'all have all been listening to that. Critical care drugs administered intravenous should be infused with a programmable infusion pump that allows a nurse to enter the name, dosage, concentration of the medication. If one is not available, the medication may be infused using a micro drip tubing. That's just how the tubing drips from the drop will drip from the tubing. 60 drops per mil calibration. However, manual infusion of critical care medication should be initiated only under the most dire circumstances, which, in our nation right now, we might be seeing some of that because there's only so many pumps available. Administer routine IV fluids and IV piggybacks. Medication involves calculating the flow rate, milliliters per using electronic. If you use an electronic infusion device or drops per minute, manual gravity control. We go back to chapter 13 and we talk about that a little bit. So we will um, need to continue to talk about that. Um, we need to start infusion pumps that have made weight-based IV therapy sampler. The patient weight, medication dosage amount of diluent, desired length of time for infusion can be programmed into the pump, and the pump will infuse the solution at the correct rate. Calculating milliliters per hour infusion rates from milligrams to minute, micrograms per minute doses. There again, we just have to know what we're asking for. It's all set up in dimensional analysis, and y'all are probably looking at me cross-eyed right now. But really, once you learn dimensional analysis, you can do this. This is what I told y'all in the beginning. So we need to really, really pay attention to this. Okay, let's start with calculating milliliters infusion rate from. Um, Let me just end this. I'm not gonna put this one up. And string in. Hey.